Okay, hello, good morning. My name is Nas. Today we have a very grateful and respectful Dr. Tamojit from Shunne Eye Care Hospital in West Bengal. So, we are talking about diabetes, its impact on eye health. So, we all know that diabetes is very common disease in India, and now India is becoming a hub of diabetes. But people don't know this. It's totally effect on their eyes. So, please tell us, sir, what are the side effect of diabetes on our
Okay.
eyes?
Okay. Basically, diabetes is a systemic disease. Actually, it involves the both eyes, and nowadays it's become an epidemic. So
Epidemic.
in every house there is a diabetes patient.
Yes.
Actually, the diabetes patient actually that basically depends on the duration of the diabetes is basically important. So if there is a long-term diabetes, though the eye vision is normal, but it can affect the retina as well because the diabetes basically it's a vascular disease. It causes the vascular. There is a microaneurysm and everything that is outpouching from the vessels, and ultimately it causes the vitreous hemorrhages inside the eye. It also involves not only the posterior segment; it also involves the anterior segment also in the like cataract can cause like diabetic corneal edema that can cause, and also this there is a chances of optic nerve disease like diabetic papillopathy that is also happening. So diabetes basically it involves the eye in the multi-strata level.
Sir, so is it caused for a blindness or
Yes,
lose vision?
actually, at first, the diabetic retinopathy starts with a slight difficulty of vision, and ultimately it goes and it really progresses, depends upon the duration of diabetes, and ultimately it involves the total eye, and ultimately patient becomes blind.
So, sir, lifestyle matter in it?
Yes, the lifestyle basically it involves because the diabetes it basically it involves it actually the lifestyle like you have to do the diabetic diet, you have to take the diabetic diet, you have to take regular exercise and everything. So it can involve the progression of the diabetes, and also it decreases the blood glucose level, and this blood glucose level basically if it is the HbA1c is the important factor for that. If HbA1c becomes normal at the ranges of below 6.5, and you can then the diabetes will be well controlled and progression of the disease will be less chances of death.
So, sir, what is the correct time to for a checkup? Who is a
Yes.
diabetic patient?
The correct time basically any diabetic patient who present to the clinic of any endocrinologist or any general physician, she or he should be first examined by an eye surgeon for diabetic retinopathy screening, because diabetes can involve if the patient is first time diabetic, that means patient can be diabetic for long time ago.
Long time.
Suddenly there is some due to some reason he have to check his blood glucose level, and suddenly found that there is a diabetes. So there is a protocol, that means that you have to check the blood glucose level at first time. Okay.
So, sir, is it depend on our genetics or something else?
Yes, if there is any family history, like in the first degree relatives if suffers from the diabetes or diabetic complications like renal failure, in that cases, always the diabetes should be, it is linked with the genetically. Linked genetically, it can occur in your offspring, in your siblings also.
Thank you. Sir, can diet and nutrition help with the diabetic eye health?
Yes, diabetic eye, that means the diabetes, there is some, if that it is diabetic retinopathy progresses, you have to take the low glycemic diet. Like you have to take the vegetables, not the, which have no low calorie value. You have to take the seasonal fruits, but the fruit with low glycemic index, like apple, you can take guava, but you cannot take banana or that is the which are high glycemic, and this is regarding the fruits. And regarding the diet, you have to take low carbs diet. Protein should be restricted at first because in the later cases of the diabetes, it involves it actually causes the chronic renal failure. In that cases, you should take the low protein also, but carbohydrate basically it should be restricted every diabetic patients.
So thank you so much, sir. Is there any other advice you want to give us?
At first, we can give that if the patient is actually first awareness regarding the awareness, the diabetic patients basically they are not aware that how much after which time the eye can be involved. So for this reason, if they have to check in the eye regularly, that is at least once in a year. That's it. So regular checkup, low carb diet, regular exercise, and diabetic screening is also important. Like
Okay.
HbA1c screening regularly once in a year should be done.
So thank you so much, sir,
Thank
for
you.
awareing our people for diabetes. Can also affect our eyes. So thank you so much for coming here. Thank you.
Welcome.